Hello FMG, today we are going to study next 100 questions in gynecology and obstetrics. Multiple births are commonest among Negroes. Length of female urethra is 40 mm. Commonest complication of pregnancy in India is anemia. Cervical incompetence is treated by Shirotakar, McDonald and womb. Commonest cause of secondary amenorrhea is pregnancy. Medical terminal pregnancy is legal in pregnancy after 20 weeks. In transfer lies the presentation is shoulder. Maximum amount of amniotic fluid seen at 36 weeks. Commonest presentation of large cervical fibroid, retention of the urine. Signet ring is an ovarian tumor, is characteristic of Cryptomania tumors. In multiple pregnancy, most important complication is PPH. Internal proteolytic version is done under general anesthetic. First trimester abortion is defective genesis. Second trimester abortion is incompetent cervix. Meji's syndrome is hydrothorax, ascites, fibroma of the ovary. Feature of vaginal trichomoniasis is yellowish green discharge, itching. Drug of choice is metrogyl. Contraceptive pills with least failure rate is combined pill estrogen progesterone. Which type of eclampsia has the worst prognosis? Antepartum. Treatment of neglected shoulder presented in heavy serration. Commonest site of injury of urethra in ectopic is crossing by uterine artery. VVF is in India most commonly due to prolonged labor. Commonest cause for ruptured uterus is obstructed labor. Most common feature of cervicitis is leukocoria. The commonest cause of retrovirtual uterus is congenital. Antihypertensive drug which inhibits labor is dioxide. Sex determination in early pregnancy is done by amniocentesis. Most important cause of mortality in obstetrical anesthesia is aspiration of omitis. PEG cells are seen in tube. The disease which shows improvement with pregnancy is Methician gravis. Definitive sign of pregnancy is fetal skeleton in X-rays. Paracervical block is associated with danger of fetal bradycardia. Nanozol is used to treatment of endometriosis, DUB and fibroid precious puberty. Cystosol is formed by the base of the bladder. Treatment of choice in 56-year-old female in endometrial cancer is pan-hysterectomy. FSH is secreted by anterior pituitary. Ovulation coincidence with LH surge. Uterine reluctance is isosuprine alcohol salbutamol dioxide. Least common pelvic is palpitoid. Organ which is affected least in IUG or is brain. Commonest tumor of cervix is squamous cell CA. Ovarian tumor commonly arises from surface of epithelium. Intrauterine copper T200 refers as 200 square mm of copper. Maximum action of corpus luteum is at 9 days after menstruation. The site of tubal block can be determined by hysterosalpinograph. Most reliable method of proving fallopian tube patency is hysterosalpinograph. Post-pill amenorrhea is treated by clomiphene. Chandvin's sign is bluish discoloration of vagina. Episiotomy is best done by mediolaterally. Oligohydromens is seen in renal agenesis. Common site of implantation occurs in ectopic pregnancy is ampulla fallopian tube. In vitro fertilization is done for tubal disease. Feature of Stein-Levitard syndrome is hysterism, amenorrhea, bilateral polycystic ovary and obesity. Cryptomania is seen in imperforate hymen. Commonest cause of breech presentation is prematurity. Cause of retention of urine is OBS, gynec is hematoclots, retroversion, impacted ovarian tumor and cervical fibroid. Best method of localization of placenta is USG. First sign of puberty in female is Ehrlichia. Maternal antibodies are present against mumps, measles, polio and tetanus. Most common anomaly bicornate. Most reliable diagnosis is identiform mole is USG. Featured abnormality in pregnancy with diabetic mellitus is sacral agenesis. Size of ovum is 0.13 mm. Length of fallopian tube is 10 to 12 cm. When is pregnancy terminated in hyperemesis gravidarum, vomit greater than 3 months, and decrease urine output and increase urine acetone. Postcoital test is used to assess cervical factor. 100% cure rate for carcinoma cervix is seen in institute carcinoma. Maker in chorea carcinoma is HCG. Anencephaly is best diagnosed by 12 weeks by USG. Amniotic fluid alpha fetoprotein is raised by open ureteral defect IUD. Ideal contraceptive for newly married couple is OCP. Prolactin secretion is inhibited by dopamine. Cause of recurrent missed abortion at 10 weeks is chromosomal abnormality. TB drug not safe in pregnancy is streptomycin. Amenorrhea due to high LH and FSH is due to ovarian failure. Cause of ectopic pregnancy is IUCD, tubal ciliary damage, late fertilization and endometriosis. Vulval vaginal candidiasis is more common in diabetes. In pregnant patient, rheumatic heart disease failure does not occur if she has a hypothyroidism. Aminosynthesis is best diagnosed if done in 16 to 18 weeks. Best evidence of ovulation is secretory type of endometrium. A broad flat pelvis is characteristic of palpitoid type. True pelvic refers to lower part of pelvis. In multiparous human, external O is transverse. Least vascular part of uterus is middle. Physiological amenorrhea is present in pregnancy, lactation, pre-puberty. Myocotic vulvovaginitis is due to candida. Commonest cause of rectovaginal fistula is improper repair of perineal tear. Earliest engagement seen in frank breech. Shoulders hystonic is seen in predominant anencephaly. Pap smear is taken from posterior fornix. Ovulatory period corresponds to 14 days before menstruation. OCP is contraindicated in diabetic mellitus, hypertension and fibroids. Asherman syndrome is characterized by amenorrhea. Study of fetal parts in first trimester with least radiation hazard is USG. Cause of breech hydromesis, separate uterus, hydrocephalus. Urine is collected for examination in the pregnant female in early morning urine sample. Endometrial biopsy for infertility is taken to 23 to 26 days. Drug of choice of PIH is hydralazine. Commonest complication of pregnancy after completing treatment for genital TB is ectopic pregnancy. Lymphaticus of ovary drains into para-aortic lymph node. Failure of OCP is most commonly due to improper usage. Drug of choice for Shishan syndrome is cortisone. Shortest diameter of fetal skull is biotemporal. Commonest cause of death in CS cervix is renal failure. Primary amenorrhea is when menstruation does not occur even after 18 years. Copper T act as by causing aseptic endometriosis. Fetal scalp blood pH of less than 7.2 is abnormal. Development of septic defects in heart occurs at 5 to 8 weeks. Germ cell tumor dysgerminoma, teratoma, embryonal cell carcinoma. which is not transmitted to baby at delivery, toxoplasmosis. Nuptial follicles occurs in erosion of cervix. Internal rotation occurs at ischial spine. Confirmation of diagnosis of vesicular mollis USG. Immediate complication of evacuation of vesicular mollis, incomplete evacuation. Contraception of choice for working woman. Irregular and profuse bleeding is OCP. Contraception of the choice of postpartum middle-aged woman in child. One child is copathy. And equivalence evidence of heart disease in pregnancy is diastolic thrill and murmur. Vaccine not indicated in pregnancy is rubella. Vaccine indicated in pregnancy is polio, typhoid and tetanus vaccine. Commonest sites for fibroid is intramural. Systemic metastasis is commonest in choriocarcinoma. Best method for inducing mid-trimester abortion is prostaglandins. Gestational tropoblastic tumors occurs most commonly after spontaneous abortion. Necklace pelvis absence of one ala. Robert's pelvis absence of both ala. Method of sterilization least situated for recanalization is bipolar catheterization. Postmenopausal woman has 4 into 4 cm ovarian mass. Treatment of choice is surgical exploration. Best method for CS cervix screening is pap smear. Which heart disease has worst pregnancy is pregnancy's mitral stenosis. Which heart disease has highest mortality in pregnancy? Pulmonary hypertension. Treatment of choice for identiform mole in 40-year-old woman is hysterectomy. Gonadotrophic is a glycoprotein. Features of DUB uterine size of 8 to 10 weeks. Menorrhagia, proliferation endometrium. Berthollian ducts open into groove between labia minor and hymen. Platogram helps in detection of obstructed labor. Peptide hormone, oxytocin, prolactin, growth hormone. Effective pressure to be achieved in vacuum expression is 0.6 kg centimeter square. Pregnant lady on oral anticoagulant should switch over at heparin at 12 weeks. Surgery for mitral stenosis during pregnancy is ideally done at 14 weeks. Fetal blood loss occurs in vasa previa, which ovarian cyst does not undergo malignancy is dermoid. Treatment of choice is perimenopausal woman in bleeding PV due to multiple fibrosis is TAH. Supports for uterus sacral ligament, Macron-Ron's ligament, transcervical ligaments. Which part of hymen rupture first is posterolateral. In patients with third generation of perineal tear presence after 1 week repair done should be done after 12 weeks. Postterm pregnancy is that which continues beyond 42 weeks to 94 days. Ideal age for repair vaginal agencies is 3 years. Congenital malformation is used for drug in first trimester is seen in steroids. Spasmodic dysmenorrhea is seen in submucous fibroid. Incidence of ectopic pregnancy is highest in prostaglates. Radiological investigation female of reproductive age should be restricted to first 10 days of menstrual cycle. Tumor marker secreted in choriocarcinoma is HCG. LH is required for follicular growth. Contraction stress test is used to detect fetal hypoxia, which anticoagulant is not contraindicated in pregnancy is heparin. And microcephaly is common in mothers with alcohol addiction. ABO incompatibility occurs when mother's blood group is O group. Vulva CA metastasis to which lymph group is lingual nodes. Most common during vaginal delivery in diabetic militant patients shoulder dystonic. Postpartum hemorrhage is present with blood losses exceeds 500 cc. Symptoms of menopause or breast treated by estrogen. Earliest and most reliable sign of preeclampsia is hypertension. Most common mode of spread of genital TB is hematogenesis. Rate of amniotic fluid turn over 300 cc per hour. Type of pelvic synergoid race is anthropoid. Single most effective drug in eclampsia is magnesium sulfide. Hypertrophied uterine vessels become obliterated by thrombosis immediately after delivery. Bonus test is used to demonstrate stress incontinence. There is a steady fall in iron in which week pregnancy is 20th week. Postpartum eclampsia develops after how many hours of delivery? 48 to 72 hours. Sexual infantilism is associated with relegation of uterine artery. Chocolate cyst of ovarian arises as the result of endometriosis. Duration of lochia rubra is first 3 days of purpurium. In DUB, the deficient hormone is progesterone. Condition is said to improve the pregnancy sacrosis and methicillin gravis. Bladder should be empty within 6 to 8 hours of delivery. Main source of physiological secretion found in vagina in the cervix. Treatment of choice for badly infected episiotomy is sits bath. Symphysiotomy is indicated in contraction of outlet. Attacks of flushing and sinuses occur. Which type of ovarian tumors is carcinoma tumors of ovary? Most common early symptoms of uterine rupture during labor is pain. Narrow spot of fallopian tube in interstitial portion. Treatment of choice for single large fibroid in 40 years old female is hysterectomy. During uterine contraction of labor, the uterine blood flow decreases. Earliest sign of placental separation is change in shape and consistency of uterus. Fibroids in pregnancy should not be removed. Suction evacuation can be done up to 10 weeks of pregnancy. Tubectomy in heart patients who has recently delivered is best done after 1 week. Basal body temperature falls down at the time of ovulation. Normal fetal heart rate 37 to 40 weeks of pregnancy is 120 to 160 meter. Pre-rectal palpitation of uterus is done in Vigrines. Amniotic fluid is the term contains glucose, prostaglandins and estrol. Patient in copathy but has conceived but does not want to conceive. Conception treatment of choice is menstrual regulation and sterilization. Ovarian of tumor diagnosed after delivery should be removed within 48 hours of delivery. 60 years female in bleeding PV on examination senile vaginitis. Patient require immediately cytology and colposcopy. Best proof of ovulation is by endometrial biopsy. The Pinard maneuvers is seen in breech delivers. To diagnose fetal well-being, most reliable method is USG. Best method assessing fetal well-being at the term by serial estimation of ostrol. In second trimester, intra-amniotic injection of which can be done to 30% to 50% of glucose. Turner syndrome is associated with 45 chromosome and low level of FSH level. In delivered lactating mother, oral pills of choices mini pill. Uterine blood flow at the term of 750 ml per minute. Degeneration of fibroid is due to thrombosis of veins. Incidence of stump carcinoma is 16%. Most deaths involving placenta previa result from hemorrhage. Palm leaf cervix pattern occurs due to estrogens.